Acne is a disorder of the skin that focuses on what we call the pilosebaceous unit. Simply said, skin, hair, oil glands. When they come together on your face, acne is situated in that particular area. Why don't we get acne as babies? Why don't we get acne when we're 5, 6, 7? What happened? Well, as people begin to go from being boys and girls to being men and women, there's a hormone shift. With that hormone shift, people begin to develop different things, body parts. But most importantly, what's happening to your skin, your oil gland is getting bigger. So you're producing a lot more oil. You produce a lot more oil, and then in those pores, you have bacteria, especially a particular kind of bacteria we call Propionibacterium acnes. This Propionibacterium acnes live on the skin, and then they live in these pores. As the oil glands grow and produce a lot more oil, these bacteria multiply. They break down the oil, they form what we call fatty acid, but the simple way to think about it, inflammation. Your body doesn't like stuff where it doesn't belong. So your body sends white blood cells or sends your immune system to fight against this bacteria, fight against what's going on in this pore, and then now you have inflammation. So think about that. Like I like to use that an analogy, a volcano, right? Volcanoes can be at rest. So you just think about this pore with the hair follicle there is at rest. All of a sudden, oil is getting bigger. Bacteria is getting bigger. White blood cells come in there, they're fighting, they're breaking down this bacteria. Now you have this, hate to say it, but pus. You know, you have all this stuff causing in this very small, my hand is very big, but think about your little pore. This is going on all in there. And so you get red, and then you get these comedones, and voila, you have acne. I always like to talk to my patients and tell them there are 3 major types of acne. You want to talk about the comedonal acne. Comedonal acne is when you see just little bumps, not redness, not inflammation, just my patients like to call them spots. I have spots on my face. Usually these spots are the same color, either the same color as the patient's skin, or they have little, should I say, keratin, what we call keratin plugs. People like to call them blackheads. So just spots that are skin colored and blackheads, we call that comedonal acne. Then there's inflammatory acne. That's when people have these red spots, inflamed, painful. That's something you see yellow pus-like stuff coming out. So there's an inflammatory acne. So we have comedonal, inflammatory, and the third one is called nodular cystic acne. This is the extreme kind of acne where you see big bumps under the skin. Sometimes they don't even break the surface, but they are painful. Some of them are full of pus. So those 3 types, sometimes they are married. And you have patients who walk in and they have comedones, they have inflammatory, and they have cystic. Not everybody has just one kind, even though I've seen patients who just have comedonal and people who have comedonal and inflammatory. Some people have a hodgepodge of all 3. And then a little one over here is acne that's caused by other things, maybe hormonal surges, disorders that deal with your hormone, births, genetics, environment. You know, there's one I usually find called pomade acne. Pomade acne is people who put very thick oils in their hair tend to get acne around their hairline. And that's a whole different thing, where it's an outside factor causing acne. If it didn't occur overnight, you know, you should try and disillusion yourself from treating it overnight. As a physician, my job to handle expectations. The reason why a lot of patients go from doctor to doctor to doctor is many times I feel like the education part of it and understanding that there's some tincture of time to treat it, especially a condition like acne. As we delve into what acne is and how acne develops, you realize that it's a process that your skin, your hair follicles, your oil glands working all together with bacteria and other things to make acne. So it's a process that the acne forms. Very rarely can you erase that process overnight. You may be able to treat one zit maybe with some caustic material that you put on. But the things that I always tell my patients you might have to worry about is, will what you put on your face to get rid of acne overnight leave scarring? So the process is, how do you get rid of acne, and how do you keep it controlled or keep it away permanently? Not just, oh, I got a spot today, I want to treat that spot. Can you get a regimen that can use that controls it long term? Why are people prone to chronic acne? Why does it seem like I've had acne since I was 7 years old, I'm now 50 and I still have acne? I get that question all the time. For people getting acne is still adolescents. Even though that number has shifted, it's usually characterized between 12 and 24. But in this age of kids maturing quicker, pre-pubescent, people are getting acne as early as 7 to 11 years old. Now, the acne is usually shifting the hormone as people go through puberty. The oil production increases. There's a particular kind of bacteria that breaks down this oil, leading to this what we call follicular keratinization, which is dead cells blocking the pores. So the combination of hormone surging, or hormone increases, excess oil, now you have a pore that is full of dead cells, oil, and bacteria, and that's really the basis of what causes acne. Now, why does it go long term? There's definitely been it's a popular belief that there is a genetic component, because we have seen in what we call twin studies, where twins tend to have identical type of acne and severity. Families that have acne tend to have kids who have acne. But in terms of tying a direct genetic link, we don't have that. We do have some, should I say, genetic components, or we say some genes that we know that cause acne, like genes that code for what we call tumor growth factor beta, and other inflammatory mediators, that if you have a higher component of those genes, you could get acne. But the long story short is, some people are going to have acne for short periods of time, just in their adolescence. Some people have late onset acne. I've seen ladies who walk in their late 20s who just started having acne. And I've treated patients who are 40 and 50 years old who are still dealing with acne. We don't have all the answers, but we kind of know, if you go down to the basic unit, what causes acne and how to treat it. First thing I want to know is this your first time of having an acne breakout? If it's the first time of having acne breakout at age 50, then I'm beginning to think, okay, are you under a lot of stress? Are you doing anything cosmetic-wise? There's something called acne cosmetica, where you put certain kinds of makeup on that could clog the pores and create the situation where people get acne. Another thing I would like to think about is there anything due to work? You know, there's acne that's due to a lot of heat, or is there a hormone shift? Very popular nowadays is, and I laugh because anytime I think about it, I think about how there's some things that are illegal in the sport world, like people trying to stay young due to performance enhancing drugs. So it's illegal, or should I say it's a rule break to play sports, to be a baseball star and get growth hormones because you want to hit the ball further. But that is also making its way into just life. People are trying to stay younger, so they're getting hormone supplements. People are getting on testosterone, hormone pellets. And they don't realize that by adding these hormones, while it helps you in terms of vitality and reduce the symptoms of menopause and all those kind of things, what causes acne in adolescents? Change in hormones. So here you are 50 years old, and you've created that same situation where there's a change in hormones. And so sometimes that's one of the things I'm also catching, is it could be that hormone shift. So what do I tell my patients? I say the first thing you want to do when you're dealing with acne is you want to deal with the oil production. So everyone should be on, who has acne, should be on a topical retinoid. The way I like to break it down to most of my patients is, if you think about vitamin A, if vitamin A is like that, a retinoid is like that. So it's just a change in the chemical bond. For everybody who is very organic centric. I like to make it very simple because you don't like to put foreign things into them. I said, look, you could try a retinoid. It's a vitamin A derivative medication. People know about it from anti-aging creams, retinol, but retinoids are excellent for comedones and acne. What it does is it helps decrease the oil production. It helps with that where the dead skins fall in a normal fashion, clogging the pores. It helps with that. And it lyses the comedone, the acne itself. So you're getting, should I say, a threefold blessing, right? You're dealing with the acne, you are treating the skin, and you're getting the anti-aging component. So first thing I tell all my patients who are 50 and above, I'm like, you should already have been on a retinoid, but now that you're getting the acne, you need to be on a retinoid. And then we talk about other regimens that we can throw into play to help them control the acne. So the first thing I tell people is I like to define, it's easier for you to fix something when you understand what's causing it. I hate being a doctor who says, hey, you have acne. Here are 3 creams. We're done. Patients are less likely to comply when they don't know why they're using the medication. So what we will try to do as dermatologists, what's your doctor supposed to do? What are you supposed to do? You want to handle the oil, you want to handle the bacteria, and then you want to handle the skin. So how do you handle the oil production? That's where the retinoid I mentioned comes into play. So retinoids help with decreasing that oil clog up, breaking those comedones down. How do you handle the bacteria? Most patients just deal with bacteria, right? Oh, we want to go online and buy a cream or a medication that's going to cleanse all the bacteria off our face. So we're going to go down, we're going to put the peels, but you're only dealing with one thing. You haven't dealt with the oil. We as dermatologists also want to do that. We also want to deal with the bacteria. So we put you on some cleansers like clindamycin or benzoyl peroxide that deals with the bacteria, right? And then my skin, how about my skin? Well, that's where you come in with the moisturizers, the cleansers, the chemical peels, things like that, just to deal with the skin. But most importantly, oil and bacteria. So every patient that comes in to my office that is dealing with acne, I tell them those 2 things we have to be tackling at the same time, bacteria and oil. So a retinoid and something that deals with the bacteria, either topically or orally, or a combination of both. Tea tree oil is from a plant from Australia, and it's been shown to have what we call antimicrobial. So when you say an antimicrobial, it means it kills microbes. Anything that's microscopically, you think about it, kills some bacteria, it kills some fungus. So it's very broad. So using tea tree oil, I can't come out and just say, hey, you can't use tea tree oil. But I always emphasize to my patients that tea tree oil has been found to cause what we call contact allergic dermatitis. What does that mean? It means that for some people, putting tea tree oil on your skin will actually trigger an allergic response, redness, itching. Think about poison ivy, for example. So here you are trying to deal with acne. You already have a skin problem, right? And now you're going to put on something that you're not sure whether you're going to react negatively to it. If you have a history where you've used tea tree oil before and you don't got any negative reaction to it, I don't come out and say, hey, don't use it. I just try and give you things that I know, because what exactly are you trying to do? You're trying to deal with the bacteria. Dealing with the bacteria is very important. If you are against everything else I want to give you to deal with the bacteria, and all you want to do is tea tree oil, but you haven't any negative response, I say go ahead. But if you're going to try it for the first time, I always say be cautious, maybe do a test spot first, see whether you react, and then that could be your antibacterial component, but you still need something to deal with the oil. Aloe vera has been shown to be very good for what we call thermal wounds, ulcers, and some skin infections. Would I say, hey, use it for acne? What I always tell my patients is there have not been any clinical studies, where you're like, okay, here is a patient who uses nothing but aloe vera, and here's a patient who is going to use something else, and let's compare and see what happens to the acne. So I can't vouch for it from a clinical evidence standpoint, but one of the active components of aloe vera is salicylic acid. So if you think about it from that standpoint, if there's salicylic acid in aloe vera and there's salicylic acid in your Neutrogena wash, so yeah, you could possibly use it for your acne. But being a medical profession, I'm always trying to give you a clinical base, what we call evidence-based medicine. Studies have shown when you put 50 people through this particular situation, controlled, this has been the outcome. Some of my patients want that. They want me to be able to speak definitively that this has been studied and has shown that usually 90% of the time, A plus B equals C. I can't say that for aloe vera, but I do understand, and I've seen that, I've learned that salicylic acid is a component for it, so I can't speak against it. It is a natural thing that you could use, and another caveat, aloe vera is also for some people a contact allergen. So if you notice that some allergic reaction to your aloe vera, you want to stop it. Okay, so the generic name of Accutane is isotretinoin. Isotretinoin is a retinoid, but it's taken systemically. It's been out for over 35 years. I actually went to where I studied, SUNY Downstate, Brooklyn. My late chairman, Dr. Shaliter, did a lot of the studies. He was considered the acne king because he did a lot of studies for isotretinoin. It's a great, great medication for acne. Unfortunately, there is a lot of myth out there. People online talking about, oh my gosh, I was very dry, or suicidal ideation. So if you go online, I tell most of my patients, if you go online, you can find the side effect and the negativity for any medication, Tylenol, right? But if you're dealing with acne, you want to sit down with a medical professional, preferably a dermatologist, a board-certified dermatologist, and let him talk to you about your risks and your benefits from using isotretinoin, Accutane. Has been proven to be very effective. I have patient pictures before and after. The average time you're going to be on Accutane usually is 6 to 7 months, right? I've seen patients who walk in with, when they say you have a face for radio, horrible acne, scars, nodular, cystic, looking down when they talk to you, and 7 months later, smiling, walking with sunglasses on their collar, feeling very self-assured after their acne is completely clear. So isotretinoin can have that effect on people. So I'm not hesitant at all to prescribe isotretinoin. The things to look out for, I want to handle the first thing, suicide ideation, right? Committing suicide. That's the biggest fear of any parent who's walked in. Oh my gosh, I've heard isotretinoin causes suicide. Well, people who have committed suicide, the challenge is, does being on isotretinoin cause people to commit suicide? There has never been a direct link to that, right? Think about people who are on isotretinoin or Accutane. They're usually a lot teenagers. They go into multiple changes, the multiple confounding factors. Is it the hormone change from just youth? Is it the psych issues in the particular family? What compounding factors surround this particular suicide versus just blaming it on isotretinoin? I always give them an example of a patient, a colleague of mine, who was about to start a patient on isotretinoin, and a week before she was going to start him on, he committed suicide. And she called me really concerned about it. And I was also very concerned. But I also pointed out to her, I said, can you imagine if you had started him on isotretinoin? The story would have been isotretinoin led him to commit suicide. So I tell patients that the risk is out there, but no responsible doctor puts a patient on isotretinoin and does not have contact with them every month. It's one of the rarest risks. If there's any mood change or affect change, you're on a medication where your physician has said could cause some mood change, you stop the medication. Usually with any kind of side effect with isotretinoin, it stops once you stop the medication. So one thing that every patient will have on isotretinoin is dryness. dryness, lip chapping dryness. Some patients have like dry eyes where they need to use like water. Face is dry, so you're going to have to use a lot of moisturizer. So once I prepare my patient saying that this is not may happen, this will happen, they are armed and ready for a 6 to 7 month course of lots of Vaseline, lots of Aquaphor, maybe some Visine. What's the second thing we watch out for? Well, we watch your cholesterol and your triglycerides. Those two things, that's why when you're on isotretinoin, usually you do a lab every month. And your doctor is checking the rise. Some patients do get a rise, but it's not elevated to a sufficient where it's concerned. So we keep you on the medication. But even if that happens, by reducing the dose, that rise usually goes down. So those are the two things we really look out for. But suicide, I always tell my patients, I said, look, it's such a, or should I say mood change, is such an obscure risk for a medication that has been out for 35 years, that if a patient comes in and they're having scarring acne that's altering their self-esteem, and, it's been shown to cause social isolation, depression, anxiety disorders. So your acne may lead you down the road of suicide or depression. So why not give it a try? That's always why I say, give it a try, give it a month. If you notice any kind of mood change, we stop it. Patient came in and said, I yelled at a friend of mine at a party, so I feel I need to get off Accutane. I said, okay, we get you off Accutane. I had a patient come in who said he's found himself thinking too much. We stopped the medication. Never had a situation, and none of my colleagues, people who are my friends that I'm close in contact with, have had a situation where a patient has been on Accutane and has committed suicide. So I'm very, very, should I say, confident in the medication, and I'm confident if used right, it's not only a gold standard, it's practically a necessity for patients who are having very bad, uncontrolled scarring acne, who have gone through the regimen of oral antibiotics, topical antibiotics, topical retinoids. What else are you going to do for someone who wants to get rid of their acne? Give them a chance. Monitor them closely, and I'm a strong advocate for isotretinoin, Accutane.